Okay, we're here today with Vilma, and Vilma's about to get started with our non-surgical operation. So, Vilma, why did you come in the office today?
I come in to do my first therapy because I want to be a pain free.
And you have been having a knee problem, that right knee and left hip.
Yeah,
So, how long have you been dealing with that discomfort and pain?
maybe for 3 or more years.
Wow, so a long time. What do you do for a living?
I working.
So, are you standing a lot? Are you walking a lot?
I in my job I stay sit more, but I love to do a lot of activities and I can do it no more.
Okay, because
I
the
can do
pain's
it no
just
more.
getting too
I
bad.
be at home. When I'm off, I be at home. I don't go anywhere because they
You-
bother me a lot.
It hurts. And
Even
you-
when I go to shopping, to my grocery or whatever, I have to buy right away because I can't.
Right, right. So, what is your discomfort level right now on that knee?
10.
It's a 10, and it's always a 10.
Yeah.
Is there anything that you do that makes it feel better?
No.
Is there anything that you do that makes it feel worse?
Yeah, when I walk, oh my God.
Yeah, just walking because really.
Walking, even walk, is a bad for me.
So I know we're gonna set some goals for you. What is one of your goals? I hear you're going on a trip soon.
Yeah, I go on my trip in the December 9, and I want to feel better. I want to walk. I want to enjoy my trip with my
And where are you
family.
going?
Spain.
And what are you gonna do in Spain?
Dancing.
You want to be dancing in Spain? Absolutely. We're gonna get you there. So tell me, how do you feel about working outside your insurance?
Very happy. I'm very happy. I do whatever I need to do to be pain free.
Exactly. Whatever cost it is, you're going to get better and you don't want to have surgery.
Yeah. Mhm.
Perfect. All right. So, Vilma, I'm going to have you do a couple different exercises for me. And one of the exercises that I'm going to have you do is I'm just going to have you stand up for me. Just go from a seated position to a standing position. Okay. Where did you feel that?
But over
Right
here.
there, underneath that kneecap and on the inside. Any other place hurt you whenever you tried to stand?
When I stand in my hip.
And that hip right there too. Okay. All right. So I'm going to have you take one step forward. I'm going to have you put your arms out in front, keeping your heels on the ground. How low can you go down? And I know squatting's very difficult for you. I can see in your
So
face.
painful.
And slowly come back up. Where did you feel it?
Painful.
Did you feel it the same spots on the inside and on below that kneecap? Okay. All right. Your next trick, we're going to have you go up and down the stairs. I want you to hold on to that railing. And you live on a second story, so
Yeah.
you have to go up and down stairs every day several times.
Thank God that I have bars.
Yes, that you have handrails. Yes. All right. And we're going to go back up the stairs. It is beautiful out here today. Okay, so Vilma, was it more painful going down the stairs or coming up the stairs?
Now it was more painful to go out.
To go up the stairs. And were you feeling it in those same hot spots that you were before?
Yeah.
On the inside of that knee and below the kneecap. All right, so are you ready to get started?
Yes.
All right, welcome aboard.
Take a deep breath and pull up. 1 and 2 and 3. Bajo, bajo, bajo. Más. Muy bien. 1, 2. Keep going. All the way.
Those knees are bending much better.
Yeah, you're walking better.
Oh yeah.
We got some more.
How
work
you
to do.
feeling, Vilma?
It's different.
Much better.
What
Yeah.
changes have you noticed?
Whew. I think they went from 10 to 4 or 3.
That's good.
That's good.
That's a really good sign. I mean, there's some limitations on matter. I mean, you do have arthritis in there, so we're gonna keep working with you, but I think you're gonna do fantastic.
All right, we're back with Vilma. Vilma has finished her treatment with Dr. Davis, her non-surgical operation on that right knee. So, Vilma, can you stand up for me? How was that? Any pain or anything like that?
No, I don't feel pain now.
Oh, that's awesome. And I know you were at a 10 when we started. And I know going from sitting to standing was causing you pain. One thing that I noticed is you stood up faster.
Yeah.
You were able to move faster. All right, so let's try that squat. Take one step towards me. Feet shoulder length apart. Arms out in front. How low can you go? Vilma, that's much better. That is much better because you couldn't even squat it. Oh, look at you showing off. Go, Vilma. All right, girl, let's try those stairs.
I'm so happy.
I am so happy for you. And back up the stairs.
I don't even use it.
No handrails that time. Okay, now I'm going to really challenge you. I want you to use the handrail this time, but I only want you to place 1 foot per step.
Okay.
Okay? So I want you to try that for me, okay?
So 1,
Yep.
1, 2,
Yes.
3.
Yes.
Okay. Like this.
Yep, and now, yes. That's it. That's it. That's how you're supposed to walk up and down stairs. You couldn't do that before. Look at you. All right, back up the stairs. 1 foot per step. Look at you. Oh my gosh, I'm so happy for you. I am so happy for you. So we went from a 10, the pain level from a 10 to about a what?
About 4 or 3.
Okay, all right. So Vilma, what would you tell other people who haven't quite decided if they want to come in or not? What would you tell them?
Don't even think about it. Come. That is the best solution.
Perfect. Thank you and welcome to the family. We're going to put you on some therapies today and get you started on your nutrition.
Okay.
And we're going to have you dancing in no time.